This is a WECT Cape Fear Business Break.
Good morning, I'm Erin Kirk, and I'm here with Dr. Rosalind George from Wilmington Dermatology Center. Welcome back, Dr. George.
Thanks for having me, Erin.
Thank you. I know May is Melanoma Awareness Month, which is obviously a big deal around here.
Yes, so, especially in the dermatology world.
Right, I would imagine so. We keep you busy. So what are some of the important topics that you want to cover?
So the first thing is prevention. So how do we prevent skin cancer from even happening? And so there's a couple things you can do. One is sunscreen. We all know about sunscreen. It's the obvious. You know, people think that they're good at it, but they're really not.
Right.
So you need at least an SPF of 30.
Okay.
It needs to say broad spectrum. You need to apply it about 20 minutes before you leave the house, and reapply it every 2 hours thereafter.
And probably not into the wind with the spray.
Right, yeah, not into the wind with the spray. And I see tons of moms, their kids are popping out of the minivan and then they're spraying on them and they're just not getting the protection they're going to have. It takes about 20 minutes for it to work, so you have to put it on before you even leave for the beach.
Is there another option? I think antioxidants?
Yeah, so the other thing is sunscreen's only so good. So for daily protection, we really recommend adding an antioxidant to that as well. And those are things like vitamin C. And we have some favorites in the office that just do a really good job of adding that environmental protection.
Okay, and the last thing is how you detect it.
Yes, so it's really simple. It's the ABCDEs, and I think people know this and people are good about looking for things. About 50% of the time my patients find their own spots, which is really amazing. But you want to look for asymmetry, irregular borders, color change, diameter, so bigger than a pencil eraser, and the most important one is E, is evolution or change. Okay. So if you notice something new or something changing, that should really be checked out.
And lastly, I know you're having an event on the evening of the 11th as well.
Yeah, we're having a nice evening event to talk about Dysport and their lines of fillers, which are Restylane Silk, Restylane, and Sculptra. So a really nice product line. You can learn about those products and have a special discount that evening, as well as some hors d'oeuvres and drinks.
Perfect. And I know that they can get all the information at WilmingtonDermatologyCenter.com.
For more details, go to healthfirst on WECT.com.